Today we talk about embryo rebiopsy, giving embryos a second chance, but is it worth the risk? I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. Have you ever heard of an embryo getting a second chance at genetic testing? Well, today we tackle what embryo rebiopsy is and whether giving embryos a second chance makes sense for your IVF journey. When you get an embryo biopsy, what you expect from that is to get a result. And that result is going to help you then make decisions. But sometimes that result isn't what you expect. What you're expecting is either it's euploid, means genetically normal, or aneuploid, means genetically abnormal. But you probably didn't know this. Sometimes you can get a result that says inconclusive, or mosaic, or no result. And the question is, what do you do in that situation? Well, one option is you could biopsy the embryo again, a rebiopsy. But as you would think, is it okay? Meaning, is it going to hurt the embryo? And so what we're going to talk about today is this idea of rebiopsying embryo, what we're going to expect from those results, and is it worth rebiopsying an embryo? Now, when they take a biopsy, we are taking a few cells. We're not trying to take a whole bunch, maybe like 3 to 5 cells, because we don't want to harm the embryo. And so in a rebiopsy, there are 2 things that have to happen. The first is we have to thaw the embryo. The second thing is then biopsy it. Now we have to refreeze that embryo because you can't put it back right away because we don't know the results. And so it's going to take time for those results to come back. And so essentially you are thawing, biopsying, and refreezing. So what's happening is 2 things are happening: the biopsy and the refreeze, which normally wouldn't happen on an embryo that was biopsied once. Now, your first thought is going to be, well, that probably harms the embryo because you're taking another biopsy. And as a matter of fact, most people think biopsies hurt embryos, but in reality, we're not actually biopsying the baby, we're biopsying the placenta cells, and embryos actually do very well when you do a biopsy. When you compare it to people who don't do biopsies, they do very well, similar with regards to live birth rates when you factor in euploid status, meaning the embryo was normal. So let's talk about these situations of when you would want to rebiopsy. Well, let's say the test shows that it's inconclusive or no results. If an embryo comes back with no result, it's saying that they weren't able to get the information from the cells. Now that could be for several reasons. The biopsy might have been traumatic to the cells and they didn't survive. Sometimes the cells, when they're inside the buffer, do not survive. And so when they go to amplify the cells later, it's not able to be amplified. And what that means is that they lyse the cells to get the DNA from them. And then that DNA is amplified so they can run tests on them. Sometimes they do that and they say there was no DNA. It doesn't mean there's not DNA there. It just means that maybe the DNA was not intact enough because it wasn't protected by the buffer that then led to the cells not having quality DNA that could be amplified. So in this situation, you don't get a result at all. In an inconclusive result, what they're talking about is that they got some information, but the information wasn't clear. And so they can't make a decision. And so I tell people, kind of think of it like someone giving you clear directions on how to get somewhere. If it's clear, you can get there. But if someone's kind of not being very clear, and they're like, well, I think you go to this place, and then maybe you take a turn here, you may not get to the place you want because it wasn't clear. Sometimes the data is very noisy and it's very difficult to interpret. And so in that situation, they call it inconclusive. The last situation is going to be an embryo coming back mosaic. And the mosaic embryo is when the embryo has both normal and abnormal cells in it. There can also be what's called segmental aneuploid, which is where instead of the whole embryo being abnormal, it's just a small portion of the embryo being abnormal. For example, if the whole chromosome is missing, we would call that monosomy, meaning it's missing a chromosome. But if a segmental monosomy was there, it would be like a small portion of chromosome 9 of the, let's say, short arm was missing. So why am I telling you all this stuff? Well, because you need to know this to understand the next question. Do I biopsy that embryo or do I put it back in me? Now, the answer to that question, you need to know some other things. Will a rebiopsy hurt my embryo? What's the chances of me even getting results from the rebiopsy? And would I be okay with just transferring the embryo without the results? Now, at first glance, it seems scary to put an embryo back that you don't have results for. But keep in mind, the chance of you actually having a baby with a chromosomal problem is very small. I actually did a podcast on this specific topic. When you think about it, the risk of putting back embryo that's untested is the same thing as everyone else putting back embryos not doing testing. So it's not a big risk. Now, this only pertains to if you have a no result. If it comes back mosaic, then the question is that mosaic embryo a concern? For example, what if it's mosaic for Down syndrome? Well, that may be a little scary to put back because then you may be worried, what if it really does have Down syndrome? Because it could potentially be an embryo that has Down syndrome. And then the other concern you may have is if it comes back inconclusive, does that mean it's more likely to be abnormal? Or the same thing if it comes back mosaic, is it more likely to be abnormal? Now, if you have no problem putting the embryo back without retesting it, then that's always going to be your best choice. Anytime you rebiopsy and freeze and thaw, it's always going to add a little risk to that embryo. Even if there was zero risk from thawing it and biopsying it and refreezing it, there's always a risk that you're handling it and something can go wrong. When you handle embryos, something can go wrong. So just an inherent nature of doing it can cause problems. It'd be no different than like taking planes. If you fly a lot, the landing and the taking off is the scariest part because it's the most dangerous part. Being in the air is not the most dangerous part. So the more that you take off and land, the higher the risk it is. That's why direct flights are technically safer than taking a flight that has multiple stops. But what if you don't feel comfortable? What if you feel like you need a clear result? Well, the good news is that with doing a rebiopsy, about 95% get a definitive diagnosis. For example, if you just take the general embryos that you biopsy and get inconclusive, what you find is about 50 to 60% of them come back euploid. Even embryos that were called mosaic will come back euploid. So if you're the type of person who says, I'm never going to put this embryo back unless I know it's normal, then a rebiopsy would be very good for you because now you can make that decision to use the embryo and it's not lost. The way I look at this is if you will never use that embryo unless tested, then who cares if it's going to have a risk of being killed or something when rebiopsying? You weren't going to use that embryo regardless. But for those of you who are on the fence, where you feel like, I'd like to do the biopsy, but I'm worried it's going to hurt my embryo, then this is where we're going to talk about the next step. Does it hurt your embryo by doing the rebiopsy? Well, as we talked about with the planes, yes, there is always a risk. But surprisingly, it's not as bad as you think. We do know that the survival rate after the second thaw is lower than people who have a single biopsy. After a single biopsy and a single freeze thaw, it's around 95%. And again, that's for the entire country in these studies, not looking at our specific clinic or your specific clinic. And then when they looked at for the second thaw after being frozen again, it was more around 70, 80% survival. They also saw the same thing in studies showing that the clinical pregnancy rate and the live birth rate were slightly lower after the rebiopsy, with most clinics being around 50% for a single biopsy and around 30 to 45% after a second biopsy. Now, it's important to note that all the babies are still healthy. That second biopsy has never led to a baby having more problems. And it's also important to note that other studies have actually shown almost no difference in the live birth rates from the second biopsied embryos and the single biopsy embryos. In one study, they actually found that the biopsy itself wasn't causing any issues, but it was just the freezing and thawing a second time that actually compromised the embryo a little bit more. When they dig deeper into it, what they found is the embryos that didn't expand as well on the thaw were the ones that didn't do as well when it came to live birth rates, meaning If it was slower to expand and it took longer to expand, then that may show that the embryo wasn't doing very well. Embryos that were slower to expand were already showing signs of some poor growth and maybe some difficulty. And so even though they were rebiopsied, the embryo was already showing signs that it was not as good as other embryos. This is kind of like day 7 embryos. We know that they have a lower pregnancy rate, and that's because it took them longer to get to the blastocyst stage. Even when looking at things like day 5 or day 6 biopsies made a difference, because again, it took the embryo longer to get to that point. So that could also put that embryo at higher risk, not because of the biopsy, but because that embryo was already not doing well. This is a very important concept to understand. In your mind, you may be thinking, oh, well, the day 6 embryos are going to do worse. Yes, but not because of the biopsy. The biopsy doesn't harm them in any way. It's just that those embryos were already slightly compromised because it took them longer to get to day 6 or day 7 compared to the ones on day 5 that were ready for biopsy. This is why many clinics will actually advise you whether you should rebiopsy or not. So for example, at our clinic, we do not recommend certain embryos being biopsied because we know that they're going to have a lower chance of then surviving the thaw later and leading to a live birth. We know that the miscarriage rate is slightly higher on these rebiopsied embryos, especially the ones I talked about that were like day 6 or that didn't re-expand right away. But the reason isn't so much because of the embryo being biopsied, but the stress on that embryo that was already compromised and making it worse. I wish I could tell you which embryos to biopsy and not, but the problem is every clinic grades things different. Even the way embryologists biopsy the embryos can make a difference. So when it comes to wanting to do a rebiopsy, you really need to talk to your clinic, talk about their experience with it and whether they recommend you biopsy an embryo or not. Now, I'll go back to that point. If you're never going to use the embryo, then what's the harm? You're not going to ever use it. So if it hurts it, it hurts it. But if you're on that fence, then I'd say talk to them. And if you really don't care, then just put the embryo back. That will always give you a better chance than even rebiopsying it, meaning not hurting the embryo. Obviously, if the embryo is abnormal, your chance will be low. If you test and find it's normal, it will be higher. But the testing doesn't make the chances better. It just helps you know that the embryo has a higher chance. So when it comes to ranking the embryos and determining if they are going to come back with a good result, what you find is that no reads usually do come back with normal results, meaning if we're expecting 60% of the embryos to be normal and you had no DNA or no results, you would expect the same 60% to come back normal. So there's nothing that is being told in the no results, like there's something wrong with the embryo. The results would be exactly the same as if a results came back the first time. Now, like we discussed, if that embryo is not the perfect embryo to be biopsied, it could compromise it slightly and could increase the risk of a miscarriage. But overall, the differences are minimal. To give you an actual statistic, around 95 to 90% of previously inconclusive embryos gain a conclusive diagnosis after retesting them. And that result tends to be exactly what the result would be on the first biopsy. So again, if it was 60%, it would still be 60%, meaning it doesn't show any tipping to one side saying that the embryo may be normal or abnormal. But what about mosaic embryos or segmental amploidy embryos? What happens when you rebiopsy those? I mean, your thought would be probably they're going to come back abnormal because that's why they were mosaic. Well, surprisingly, a lot of them come back normal. In a study published in 2023 titled Blinded Rebiopsy and Analysis of Non-Euploid Embryos with Two Distinct PGT Platforms for Aneuploidy. In this study, they took 100 donated blastocysts originally classified as abnormal, meaning aneuploid or mosaic by next-gen sequencing. Then they performed 4 rebiopsies on each embryo. They took those samples and then used a SNP array, which is a different type of technology. The results were striking. Every embryo that had been diagnosed as mosaic by next-gen sequencing was uniformly euploid on the SMP-based retest, meaning SNP array. What this means is that a lot of the mosaics then are not through the whole embryo because the other biopsies showed they were normal. And so it's either possible that the technique before caused the mosaic, or they got the cells that were only abnormal causing the mosaic diagnoses. The other good news in that study was that the embryos that were considered fully aneuploidy, meaning there was no mosaicism, were confirmed when they did the SNP array. Overall, if it's mosaic or segmental aneuploid, they were less concordant, versus if it was a whole chromosomal problem, it was highly concordant. So this should reassure you that if you are concerned about a mosaic embryo and you don't feel comfortable putting it back, there's a very good chance it's probably normal anyways. And so unless it's one of those abnormal mosaics such as Down syndrome or a significant condition, you might feel comfortable just putting it back because it's likely normal. But on the same token, you can also biopsy it and feel comfortable that the results will give you some clarity and make your decision much easier. In the end, it's a personal decision you need to have with your doctor, but it's important to know that rebiopsies can provide results and most of the time do. I've seen patients who've had abnormal embryos and don't believe it, and they've rebiopsied it. And in at least the history I've had with patients, I've never seen anyone with an aneuploid embryo ever come back with a normal embryo after retesting it. Now keep in mind, when I say that, I'm talking whole chromosome aneuploidy, not segmentals, not mosaics, but the whole chromosome's missing. In my experience, I've never seen one come back normal. That doesn't mean it can't happen. We know the test is imperfect. There's always the possibility that an abnormal embryo could be normal, but it's very, very unlikely compared to the chance that it's actually correct. So in summary, if you really are not that worried and just want to put the embryo back, you can. And the risk of having a child with some genetic problem is very, very low. This will give you the highest chance of the embryo implanting, and your pregnancy rate and live birth rate would be exactly what it would be if you didn't do testing. If you're someone who would never feel comfortable putting the embryo back unless it's tested, then you really have nothing to lose, because if you're planning to discard the embryo, rebiopsy gives your embryo at least another chance without any additional risk since you weren't going to use it anyways. So in that situation, I'd always recommend rebiopsying. Why discard an embryo if it could potentially have a chance? And if you are like most people, where you really are in the gray zone, where you really don't know what to do, part of you wants to put it back, but part of you is scared, then this episode was for you to help you make that determination. Rebiopsies can clarify ambiguous results and can rescue embryos that you are maybe not going to use. But there's a trade-off. You might get the clarity, but it does have a slight reduction in the implantation. And that's because, as we talked about, the thawing and freezing. We also discussed that there are some embryos that are more suitable for rebiopsy. And unfortunately, I can't tell you that at your clinic because each clinic's different, but there are some general ideas that make some embryos better than others. Most of all, the findings are very reassuring. Mosaic embryos often come back euploid, allowing you to use it versus discarding them, just like segmental aneuploids. Studies have shown that there's no negative neonatal outcome by having a second biopsy. No matter what, the decision is going to be tough, but hopefully this information is going to help you if you run into that situation. I hope you liked this episode and found it helpful. Unfortunately, if you're in this situation, I know it's very tough. I think one thing to remember too is that a lot of time these companies will not charge you to rebiopsy these embryos. So if that's the situation like at our clinic, then there's at least no financial repercussion. If you have a lot of embryos, then you may not have to worry about this decision. But if you do, I hope this episode was helpful and helped you make a decision. As always, remember to talk to your doctor and your clinic because those situations can be slightly different. If you like this episode, as I always say, please tell your friends about us. Give us a 5-star review on your favorite medium. It's because of you of why this show is becoming more popular. And I can't thank you enough for helping me. As always, I look forward to talking to you again next week on Taco Bout Fertility Tuesday.